Registration is now open for Safety Connect, 2020's premier virtual safety conference and expo. Head on over to industryconnectsafety.com for all the details. Friendly reminder, Safety Connect is free to attend. You heard that right, absolutely no cost to you. We've got hundreds of giveaways, 3 grand prizes, world-renowned speakers, and tons of exhibitor booths to visit. Head on over to industryconnectsafety.com. See you there!
Hello and a warm welcome to everyone. We would like to wish everyone a good morning, a good afternoon, or good evening, depending on where you are in the world. My name is Samantha from Safeopedia, and here at Safeopedia, our mission is to support the EH&S professionals, operational folks, and any safety-minded individuals with free safety information, tools, and education. Here at Safeopedia, we are very excited about having our first ever virtual safety conference and expo coming up October 20th to 22nd. For information on free attendance or to set up a booth, get in touch with us today. This conference is our way of extending a huge thank you to those dedicated professionals for the great work they do on a daily basis in keeping our workplaces safe. Today, we're proud to present Safely Returning to Work After COVID-19, Managing Occupational Health Risks Within the Workplace. This Safeopedia webinar is being sponsored by Intellex. It is now my pleasure to introduce to you today's presenter, Drew Hinton. Drew is a seasoned EH&S professional as well as an EMT for the Kentucky Department for Public Health's Medical Reserve Corps. He is a proven leader with 15 years of occupational health and safety industry, as well as over 10 years as a career firefighter, EMT, hazmat specialist in Louisville, Kentucky. He holds a MS in Occupational Health and Safety from Columbia Southern University and is currently a PhD student at Capital Technology University. His areas of expertise include hazardous materials, occupational health and toxicology, emergency medical response, and confined space rescue. He currently serves on the NORA Construction Sector Council, COVID-19 in Construction Work Group, and Hearing Loss Prevention Cross-Sector Council for the CDC NIOSH, as well as the IHMM Hazmat Society Training and Education Committee. I am very grateful to have you sit back, relax, and enjoy this presentation. With that, Drew, please take it away.
Thank you, Samantha. I appreciate it, and I appreciate the opportunity. Everyone is joining us, and I appreciate Intellex for sponsoring this webinar. And what we're going to look at today is, as Samantha mentioned, is safely returning to work after COVID-19. And so we'll cover a few of the basics. I know there's been a lot of webinars out there and information that you've probably already seen, but we're going to cover all of the things that maybe is not talked about quite as much. So we're going to get into some of the contact tracing techniques, some of the site-specific risk management practices that you may run into, and then we'll kind of dive into hopefully that'll spark some questions on your all's end as well. And so kind of the agenda today, again, we'll go over some basic information about SARS-CoV-2, the virus transmission methods, how it's spread from person to person, and where we can contract the virus, exposure risk within the workplace, risk management practices, the different types of PPE. This should be a given as far as the PPE, and we'll talk more about this later. But I know that Virginia has passed the OSHA mandate for coronavirus. They're the first state to do that, and that's one of the things they did is they made a mandate for personal protective equipment within the workplace. So we'll talk about a few of the variances from state to state and from area to area. You may see differences in your part of the country. Do see those differences, I encourage you to speak up and kind of let us know about that because we're all learning from one another. And then last thing we'll talk about is contact tracing. So a lot of people has really kind of left that up to the local health departments and local health officials. And so we really don't necessarily understand a lot of the concepts on that. But what I want to do is allow us as professionals and industrial individuals to understand the contact tracing techniques, what we need to do as employers, what we can do from outside the workplace as well, and then we'll go into different methods that we can apply across the board. And so breaking into the first section, information about SARS-CoV-2. And so again, I'm going to keep this one pretty brief. We're all familiar with, for the most part, what the coronavirus is, but I do want to go over some of the basics just so we're familiar with some of the different terminologies. There's a lot of terms that are interchanged when they shouldn't be. Maybe you're not aware of the exact meaning of some of these terminologies, so we'll break into that on this next slide here. So coronavirus, that term breaks into a group of viruses. That's not just the one that we're dealing with now, but that's the ones that have the crown protein spikes that we see the pictures, as you can see on the top left and right of this slide here. So that's a group of viruses, and this is not the first one that we've had. So we've had coronaviruses in the past from the SARS and the MERS outbreaks that were in the early 2000s, 2010s. And then COVID-19, of course, is the coronavirus disease 2019 caused by the SARS-CoV-2. So the SARS-CoV-2 is the actual virus that causes the disease. And that's probably one of the things I see people use the terms interchangeably when they shouldn't be. They'll call the virus COVID-19 or they'll call the disease SARS-CoV-2 one way or another. Now, SARS, severe acute respiratory syndrome, as you can see here with some of the symptoms of pneumonia, lung failure, and death. And again, that one, they initiated back in the early 2000s. We saw a pandemic that wasn't as global as this one is now, but it is a different type. And of course, SARS-CoV-2, if you break that down into what each actual letter means. So severe acute respiratory syndrome, coronavirus, and this is the second coronavirus to cause SARS. So that's where the 2 comes from. Now, this is going to get into the contact tracing side of things. So a case and a contact is probably one of the most important things for me to understand what precautions we need to take inside the workplace and what precautions even you may have to take outside the workplace if hopefully you're not. But if you run into somebody that you come into contact with and maybe you get contacted by the local health department or whoever it may be, understanding what these terminology means. So case is somebody that definitely has COVID-19. They have the disease, and it's usually been verified by a positive lab test. So they've gotten that swab or whatever lab test that they've gone through, and they have confirmed that they do have COVID-19. And then a suspected or probable case means that somebody's been exposed to someone with COVID-19, they've developed symptoms. Maybe they haven't had a test yet, but just because they've developed symptoms and then we know that they've been exposed to someone with COVID-19, we're going to go ahead and suspect that they do have that disease, and we're going to treat them accordingly. Now, a contact, on the other hand, just means that they've been in the exposure area. So let's say somebody goes up to an organization, a salesperson goes to a facility, and the facility they're visiting, that person, they meet up with a person that ends up having COVID-19. So that salesperson that made the visit, they would be a contact. So they made contact with somebody that was infectious. But the big things we're going to focus on here is that infectious period. So we're going to look at 2 days before that illness began. And once we get into the contact tracing at the end of this webinar, we're really going to start diving deep into that. So there's 3 different types of contact. So there's physical contact, means I'm shaking hands with somebody. Maybe it's somebody you live in the same household with or whatever it may be. Second one here is close contact. So CDC provides the guidelines for within 6 feet for 15 or more minutes. Now there's some agencies and organizations that may have a different time threshold there. Some of them may say 10 minutes. I've seen some that says 30 minutes. But going along the lines with the CDC's guidelines, they will say close contact is within 6 feet for 15 or more minutes. And then proximate contact means you're more than 6 feet away, but maybe you've been in the same room with somebody for 30 minutes, an hour, or maybe the whole day. And so that may cause an increased risk of being exposed from that portion as well. Now getting more into the contact tracing terminology, isolation versus quarantine. So we're going to isolate a case. And so a case, again, is somebody that's confirmed to have COVID-19. So we're going to keep sick people away from the healthy people. We're going to restrict them to a home or hotel. And what is important about the hotel portion there is if you have field service employees that are traveling from site to site, maybe they're going from job to job, from Kentucky to California the next day, whatever it may be, isolating them to where they're not exposing other people in the hotel, that's even their coworkers or other patrons that are just visiting that hotel or wherever it may be. Separating space in hospital to limit contact, and then for the duration of the infectiousness is how long we're going to isolate them. So 2 days before onset and at least 10 days after the onset of illness where their symptoms improving and no fever within the past 24 hours. Now, on the contrary, if we have somebody that, referencing that example I gave a minute ago with the salesperson visiting a customer, if that salesperson was notified by the customer and it said, hey, we have somebody that one of our employees tested positive, you may have been exposed, we're going to quarantine that person. We're not going to isolate them, we're going to quarantine. So we're going to restrict their movement and contact of healthy people who've been exposed, and this is 14 days since the last contact. Now, one thing we'll touch on a little bit, but that really focuses on this quarantine aspect is people that live with somebody that has COVID-19. Their quarantine is going to be a little bit different because their time frame for the 14 days since the last contact is basically going to be a moving timeline. So that may be a little bit more difficult to track that one down. So just to update you on the CDC isolation guidelines, these were updated about a week or so ago. So the previous guidance was, an infected person must isolate for at least 10 days after the onset of symptoms. They can be released from that if they've improved and have no fever without use of medications for at least 3 days. Now they've dropped that down from the 3 days to 24 hours. So that was updated on the 16th, August 16th. So it's made it a little bit more lenient. We're starting to get more and more tests. We're starting to get more antibody tests out there. I know personally I went and gave blood back at the end of June, and I got an antibody test for free, and ended up checking that and got negative on my results, thankfully. But we're starting to get more and more information. I know there's still a lot of questions, still a lot of unknowns out there, but the more we find out, the more we can start loosening up these guidelines. So what happens after people get infected with this virus? So one of the biggest things that we've run into from an industrial side and from an out of the workplace side is the asymptomatic people. They have no symptoms. They don't show any kind of fever, any kind of cough, any kind of difficulty breathing. They're completely asymptomatic across the board. So you may never even know that they are having this infection in place, and that kind of leads to the whole the contact tracing technique. So some people may have a mild disease, some have the more serious death, and we will break down in a little bit later. We'll break down who is more susceptible to these diseases, which age groups are going to show more severe illnesses, which ethnicities and race groups are going to show more issues, and we'll break that down into the demographics so you have a better understanding of statistically who's getting infected. So signs and symptoms, we've all seen these, I'm sure, more than we want to see. Fever over 104 degrees, tiredness, chills, muscle pain. This lack of taste or smell is probably one of the newer ones that you're probably starting to see more and more. I've got a friend personally that they ended up having COVID-19 a few weeks ago, and that was their only symptom they had. Was they said they lost their sense of taste and smell. They said it was kind of odd. They didn't notice about it make much notice of it, but these signs and symptoms are things that we're starting to continuously develop. And then one that I've been reading up on recently, you'll see a lot of studies published from, I know CDC and NIOSH has published a few studies on this, as well as a few other agencies, is the temporary loss of hearing. So you're starting to see people that they may have no other symptoms or signs or symptoms of COVID-19, but they'll have a temporary loss of hearing. It doesn't necessarily mean they're going completely deaf, but maybe their hearing threshold has dropped down quite a bit. So again, as we go through these, hopefully this pandemic ends sooner rather than later, but I'm sure we'll start to develop even more signs and symptoms that maybe we were unaware of before. So severe signs and symptoms here. So some of those means that the disease is becoming more severe, increased or more severe fever. So again, over the 100.4 degrees, and then increased difficulty breathing is another issue there. So if you follow the CDC guidelines, in most states, their public health departments and their state governors will issue guidance on what is a severe case. And what they're doing with that is they're trying to eliminate and keep you from overloading the hospital and the medical system. So the general rule of thumb that I've heard and I've kind of followed myself is if you wouldn't, based on the symptoms, if you wouldn't go to the hospital pre-COVID-19 for the symptoms you're having, probably don't need to go to the hospital, right now. If you can just stay home, do your quarantine or isolation, depending on what case what situation you may be in. But that keeps us from overloading the hospital and making sure that the ventilators and the medical equipment, the medical supplies are given to those that actually need it and may have a higher risk. So severe signs and symptoms, bluish lips of the face could mean you have a sign of low oxygen levels. You have low oxygen levels in your lips. You may have the bluish of your fingernails and your toenails. Some of those that may be in the medical background may be familiar with capillary refill. It's a medical way that can do a quick check on your blood flow, but also you can check your oxygen levels as well based on the color of your skin on various parts of your body. Increased breathing rate. Your normal breathing rate is about 12 to 20 respirations per minute, depending on any kind of medical background you may have. But the normal breathing rate is about 12 to 20 respirations per minute. And so if you start seeing an increase in that, keep notice of that. Shortness of breath, chest pain when breathing, waking up during your sleep with shortness of breath, and then kind of a new confusion or difficulty waking up. If you see any of those symptoms, those may be telltale signs that you need to go ahead and get seen by the emergency department, emergency room at a hospital. Make sure you get seen right away because you may have some more severe issues there. All right, now the incubation period. And so what this means is the incubation period is the time from when someone is infected until symptoms develop. So this is the time that we're not aware that this person even has the disease unless they just happen to get a test that day and got the results right away. And so the incubation period ranges from 2 to 14 days. And that's a pretty big range here. And as you can see on the chart, most of the people, 95%, will have their symptoms by 14 days. So 5% only show them within 2 days. So most of those are going to be around the 1 to 2 week mark after you contract the virus before you start showing signs of symptoms. So that's a key thing for us to keep in mind, because I'll give you an example. Is we had one of the companies I used to do work with, we had a customer that contacted us a week later telling us, hey, we had a person that was confirmed COVID-19. And so we're trying to figure out, are our employees exposed? Were they just exposed? Are they a probable case? Whatever it may be. So keeping in mind that 1 to 2 week time frame is probably when they're going to show symptoms. So you want to keep an eye on that person until that 14-day time frame comes up. So the infectious period, on the other hand, is a time during which someone infected with the disease can transmit the virus to other people. So for people with this, it begins 2 days before the start of symptoms and the signs and symptoms of disease. So when we get into the contact tracing, this is one of the first things we're going to ask them is, when did you start showing signs and symptoms? So we're going to ask them, when did you start showing them? And then we're going to go 2 weeks back prior to that. And as you'll see later on, that's when we really start doing our contact tracing. Even though they didn't show signs and symptoms, we want to include that 2 day prior time frame to make sure we're seeing who else was in contact with that person. And then the end of the infectious period is defined as, again, like we talked about earlier, this should actually be changed. 10 days after the onset of the illness, symptoms are improving, and there have been no fever within the past. It says 3 days. Again, we just got updated a few weeks ago. It's now 24 hours. And then we talked about asymptomatic people. So those are the most difficult to define. We don't know that they have the disease. We don't know if they've contracted the virus unless they get a antibody test to see if they've had it in the past, or if they've got a COVID-19 test to see if they currently have it right now. And so this is a timeline of the incubation period. Hopefully it'll help paint a better picture for you. So we look at the calendar days. You're going to start on the left side of the screen here, looking at day 0. So the person becomes infected. This incubation period, as you can see by the orange colored bar there, that ranges from 2 to 14 days. So it may be 2 days, it may be 2 weeks. 5 days is kind of the go-to on that. But that's their incubation period from the time that that virus is in their body and they're still becoming infectious at the end of that. So then we're going to estimate here the 12 to 14 day mark. This person is going to become infectious. They're showing signs or symptoms at that point. They're infectious people, most infectious at day 1. So depending on when that incubation period stops is going to determine when that person is most infectious. So that's what we ask them again. When did you start showing signs or symptoms? And what symptoms were those? Did you pay attention to? Was it just a fever? Were you starting coughing? Were you starting to get, these different things that may point you in the direction of COVID-19? So we'll move forward with existing medical conditions that may cause risk factors. So one of the biggest ones we've heard about in the news and on all the medical guidelines is people that are likely to have this severe disease that they get infected are adults over the age of 65. Increase as their age goes up, their risk goes up as well, and the people who are obese. And then there's a few extra existing medical conditions, as you can see here. I'm not going to go through all of them, but diabetes, hypertension, heart, liver disease, anything with a weakened immune system, those will cause you to have an increased risk as well. And this leads us into one of the biggest things that you can do from a employer standpoint is determining who is at an increased risk. Now I know here in Kentucky made a mandate to where you have to do essentially a risk assessment to determine who is at an increased risk, so that you can determine if you need to take special accommodations to make those people less susceptible to contracting the virus. And so I'm sure it varies state to state, but if it's not a requirement for your state, it's certainly a best practice to go ahead and figure out who may be at this increased risk and what precautions do I need to take specifically for that person to make sure they're at a lower risk than they need to be. So how does COVID-19 kill you? The lungs cannot recover. The patients can't breathe on their own. So this lack of oxygen, we can only go a few minutes without oxygen to where we start getting irreversible damage. But of course, this is a variable time frame. So you may have somebody that has one of their very first symptoms is difficulty breathing, depending on maybe some of their previous medical conditions, or they may have a prolonged a string of symptoms here that may cause issues for weeks or months. Some of these long haulers, I know you hear the term long haulers nowadays, and we'll talk about that a little bit later on. There's people that show those symptoms for weeks, months later. Maybe they get tested for COVID-19 and they don't even show that they're even positive for that. So it's kind of a battle of showing, did I have it in the first place, or was it something else? Treatment of COVID-19, really all they're going to do is they're going to treat the symptoms. There's no specific treatment to cure COVID-19. I know there's a lot of news out there about these different trials and vaccinations and medications they're trying to get to work right now. Of course, if anything with a clinical trial is going to take a long time to get approved and get the medical procedures in place. So hopefully they'll get that sooner than later. But right now what they're doing is they're just treating the symptoms. So most patients with a lung disease, as you can see here in the picture, they're going to require a ventilator. And I know early on we were kind of overloaded with this. We were having a lot of people go in there. They were putting people on ventilators right away, and there was a ventilator shortage. And then you started seeing a lot of the companies that kind of step up. You saw, a lot of these major manufacturers would stop their production of whatever process or whatever items they're making, and they would change it up to make extra ventilators. And so, kudos to those companies that did that and was helping out our healthcare systems. But make sure, this is getting back to, if you wouldn't have gone to the hospital before, make sure you're staying at home and isolating yourself or quarantine based on what your situation is. But make sure you're leaving that medical equipment up to people that actually need it, so we're not overloading the medical system. So getting into the diagnosis of COVID-19, so the diagnostic test identifies the virus in the body. It tells you it's an active infection. So this is where you're getting the big giant swab down your nose to tell you if there's a virus in your body. Some of you all may have had it, some of you all may have not, but this will test people for symptoms. It's taken from the nose, throat, or mouth, but it tells you there is an active infection in your body. It tells you it's present, the virus is present in your body right now on the spot. Now on the opposite hand of that is your antibody test. So they'll take a blood test. Like I said, personally, I gave blood back in the end of June, and they just went ahead and did the antibody test with that. And so they're testing to see if your body has developed antibodies. So for those of you all that maybe not for sure what the antibody tests are, when your body develops some kind of foreign virus or foreign material and it says it's not natural to your body, it will develop antibodies to try to overcome those and eliminate that hazard within your body. And so what that antibody test is looking for those specific antibodies that the IgG that you see here, it will see if that's in there. Now, this will just tell you if you've had COVID-19 in the past. But the big thing to remember here is no tests are perfect. I've seen mixed reviews. Personally, I've seen mixed reviews for the antibody test and the diagnostic test, as far as the accuracy of it. Is it 100% accurate? Is it 95% accurate? If it comes back and says positive, I'm going to assume it's positive. If it comes back and says negative, I'm going to hope that it's right. But again, no tests are perfect. But this just diagnoses between the two different types of diagnosis that you can see here. And then as mentioned, here's a little pictogram here. The diagnostic test is a swab, the big giant swab they stick down your nose to get into the respiratory tract, and they will look for the viral RNA of that virus. And that's why you're presently have the virus, it's active in your system. Now, once the virus is gone, your body will get rid of it, eliminate it from whatever methods it does. That's when the antibody test comes into place. So after your symptoms have cleared up, this antibody test will detect in the blood if you've ever had it in the past. Now, one of the I guess one of the most promising things for us is 80% of people recover from this disease within 2 weeks without needing special treatment. And so that's, we mentioned with the people that are asymptomatic, they don't even know they have symptoms. So that's one aspect of it. But also getting to the aspect of some of these symptoms may be minor. Maybe all they have is a fever and that's the only symptom they have. Or like I said, with the friend I have that had just a loss of sense of smell and taste, and that was it. So 80% of these people will recover within 2 weeks without needing special treatment. So that's kind of promising for us. That's a good thing, and to keep in the back of our mind that statistically speaking, most of us are going to recover without any kind of issues in a pretty quick time frame. Now, these post-COVID syndrome, or what they call long haulers, you may be seeing some of these in the news in recent weeks. I know some of them have popped up in several different media outlets. But what these are, they're suffering from these symptoms for weeks or months. They may have fatigue, they may have fevers, problems with concentration, and then maybe they have a test that shows they're positive, maybe the test shows that they're not positive. But that's probably one of the biggest things with this pandemic is understanding why these symptoms are taking place. Some of them will say it's from the common cold or the common flu. Some of them will just assume it's COVID-19 and go from there. So hopefully within the coming months, and once they start learning more about this disease and learning more about the virus, they can start figuring out how to more accurately diagnose this disease in the first place. All right, virus transmission methods. And so we're going to look at evaluating the various methods of virus transmission. And so the two ways we're going to look at is of course affecting from person to person. So we've all heard about the droplets coming out of the mouth. But also the second way we're going to look at is surfaces that may have viruses from someone's respiratory droplets. And so are we properly disinfecting the surfaces that are in the workplace? Are we properly disinfecting the surfaces that are at our house, within the retail facilities we're going to, whatever it may be? There's different techniques we need to take with that. So again, the first way, infected people have the virus in their mouth, nose, and throats. And then when we sneeze, cough, laugh, talk, whatever it may be, those droplets will come out. And they can enter another person's mouth, nose, or eyes at that point. And you're starting to see a lot of these agencies, such as the American Industrial Hygiene Association, OSHA, NIOSH. I've seen a lot of agencies that will start recommending eye protection for people because of this, because they start entering through the eyes. It's something we're not really we haven't been worried about. We've primarily been worried about our mouth and our nose, and so we just wear a face covering that covers those parts and we forget about our eyes. But the second way is once those respiratory droplets get on a surface, how long can those respiratory droplets stay on that surface to where I can go back later, I'll swipe my hand up against the table or whatever it may be, and then I've got that virus on my hand, and then boom, I'm potentially exposed to it at that point. And so now we'll look into the time frames that this virus is lasting on various surfaces. And so there's a couple of different studies out here. One has been conducted by the National Institutes of Health, whereas there's a second one we'll show up here in a second. But the studies they're pretty interesting as far as showing which materials are holding on to this virus the longest. And so the longest one that we're starting to see is on plastic and stainless steel. Those are two of the longest ones, but also that's two of the most common materials that you're going to see within the workplace. And so 72 hours on plastic, 72 hours on stainless steel. So if you think about plastic, one of the things that comes to mind for me with field service employees is there's plastic trim on everybody's vehicles. And so are we bringing it inside of our vehicles? Are we bringing it inside of our plastic tables and countertops at work? Stainless steel rails, cups, whatever it may be. 3 hours in the air, 4 hours on copper, 24 hours in cardboard. And then, of course, all these time frames, these time frames that they've given are a controlled setting. And so they'll do it at lab setting. So in real world conditions, these are all going to vary based on your temperature, humidity, ventilation, and then how much virus has been deposited on that surface. And then a second study here published by the New England Journal of Medicine, it breaks it down a little bit further on different materials here. But what it has is paper and tissue paper, lasts about 3 hours, copper. So you need anything from copper in your facility to even a penny, lasts about 4 hours. Wood is supposedly lasting up to 2 days. And then this next one here, cloth, is lasting about 2 days as well. And so, I was actually just having a conversation with my daughter this morning about these cloth face coverings. She's having to wear cloth face coverings to school. And one thing that it's important to remember is that we need to wash these every single day. And so you either have the option of A, wearing a disposable face covering or respirator that you can get rid of at the end of each day, or B, wearing a cloth one that you're going to have to wash every day in the warmest possible setting that you have. But you can see here, one that was startling to me is the outside of a surgical mask. So our medical professionals out there in the hospitals and medical facilities, it can last up to 7 days. So making sure that we have a proper receptacle that we can dispose of these to where A, it's not going to cause issues for other people, but B, it can contain that hazard and keep it from spreading within the workplace. So pretty interesting statistics there. So the droplets, how far they can travel. The CDC guideline is up to 6 feet. I know you've probably seen just as well as I have. There are different opinions on this. Some people say it may last up to 10 feet, 15 feet. Now that's what they're referring to is how far those droplets can travel. That's not referring to how far that can linger in the air. It may linger in the air and then travel further, but as far as the initial travel distance, most of those are traveling up to 6 feet, and that's where they get that social distancing or physical distancing requirement that we're most familiar with. Land on surfaces, land on people's body parts, and then masks can be able to use to reduce that transmission. So how it's transmitted efficiently is they're infectious before they have symptoms. So we've talked about this before, but that is one of the contributing factors, and to me, one of the major contributing factors is how this disease is spreading so quickly is because it's spreading before we even know we have it. So we test symptomatic people to identify their contacts, and we limit the spread by contact tracing. So transmission is more likely with closer contact. So we talked about the physical contact. So if you're in the same household as someone, and you are, you're a roommate or your family or whatever it may be, that's probably going to be your most probable risk of closer contact. But if you're in the workplace within 6 feet for 15 minutes or more, sharing beds, sharing food or bathrooms, that's going to increase your risk of contracting that virus there. So this brings us to our window of opportunity for timeline of infection. So we talked earlier about our incubation period being between 2 to 15 days, and kind of the median time frame for that is 5 days. But then where our window of opportunity is before the second person becomes infectious. So we're going to track when this person started showing signs of symptoms. So person A, as you can see right here in the middle, we'll say this person A is the one between the orange and the blue frame right there in the middle of your screen. And so the day that person A starts showing signs of symptoms, we're going to start doing contact tracing. So that gives us our window of opportunity is right there between the time they show signs of symptoms to 2 days before person B starts showing signs of symptoms. So that's where we really have to focus on our contact tracing, really hit it hard, really hit it with the ground running, and make sure we're really efficient with identifying who that person may have come into contact with. Now we're going to look at what they call a reproductive number, or a R naught. And what this refers to is basically how infectious this disease will be, or how infectious this virus will spread from one person to the next. And so as you can see here, as you can see on the graph once it pops up here, it's a good way to measure how fast the disease can spread. So the next slide will show us, we'll break down into different types of diseases to show you comparison of this current coronavirus compared to some of the previous ones, MERS or influenza, rubella, some of the more infectious ones there. But we'll look at how this coronavirus is spreading, how quickly, and then the higher the reproductive number, the more people are going to be infected. So if our reproductive number, our R naught number is let's say 3 or 4, that means for every person that's infected, they can potentially affect 3 or 4 people. To whereas if our R naught number is a 1, it's pretty much going to be a 1-to-1 spread. So one person is going to affect one other person. And so again, breaking down the R naught. So the most infectious virus that we know of is measles. It has an R naught of 15. So what that means again is for every person that becomes infectious, it's going to spread it to 15 people based on the statistics. Now, on the opposite of the spectrum, for as far as MERS is concerned, it's not very infectious. It has a R naught number of less than 1. I believe it's like a 0.8. But right now, our SARS-CoV-2, our current coronavirus that we're dealing with, the R naught number is around a 2 or 3. And so it means that for every person that becomes infected, we can potentially infect up to 2 or 3 people. So it's pretty comparable, as you can see, it's pretty comparable to the influenza that we're seeing. And that's what also causes some issues with diagnosing is it's, one, it's got pretty much the same symptoms, the same signs, but also the infectious rate of it is pretty much similar to the influenza that we're used to. So this will break it down into how a virus with RO of 2 will spread. And so this chart, once it pops up here, will show you, so patient 0 infects 2 people, and then they infect 2 people on top of that. And by the end of it, it just keeps reproducing, keeps spreading things, so on and so forth. This next section here, so these statistics here are as of August 25th. So it's got 5.7 million cases in the U.S., total COVID-19 cases. Of course, those are going up daily. I'm sure that was as of the 25th, so 2 days ago. So I'm sure within the last day's statistics is probably closer to 6 million. And the current COVID-19 death rate is about 3.3%. So it looks like my slides are kind of lagging a little bit here. So we'll see if it's catching up. We'll give it a second to catch up here. All right, let's try to see if this will work. So hopefully this chart will pop up here and we'll discuss it more. But what this next slide that it will show is the COVID-19 cases by age group. And so we kind of discussed that a little bit earlier as far as, which age groups are getting more and more cases reported by the age group. But what this age group is showing here, this is a report by the CDC, is showing 21.7% of the cases are in the 50 to 64 year old time frame, and then 21.6% are the 18 to 29 time frame here. So it's actually less after that 64-year-old time frame, but that doesn't mean that's just cases. So keep in mind that's not actual deaths. So here it looks like it's actually caught up here. So you can see the cases by age group. So this is cases, doesn't mean they're necessarily dying from this. We'll talk about that in the next slide here. And so this next slide that pops up will show you COVID-19 deaths by age group. And that's where we start seeing the increase as the age goes up. So this is pretty much a straight shot. The older you get, the higher your risk of death is going to be with this COVID-19. So you can see that there. And then the next slide we have is death by race or ethnicity. So we'll kind of touch on this just a little bit. So 49.9%, almost half of them are white or non-Hispanic. The black non-Hispanics are 22.4%, and then Hispanic or Latinos are 17.1%. So those are the 3 primary groups. You see the other groups there that are a little bit less susceptible to this, I guess you could say. But those 3 primary groups kind of tells us where to focus on. And then states with the highest number of COVID-19 cases. So this next slide that pops up, they'll tell you that the total cases doesn't necessarily coincide with the total amount of deaths. So California has the number 1 amount of cases with almost 700,000, but the number 1 state with total deaths is New York with a little bit over 32,000. So you can see that there. These numbers again are changing from day to day. But I really want to get into this next section here as far as our exposure risk. We're going to start talking about our exposure risk, how to manage our exposures within the workplace, and then we'll talk about the COVID-19 contact tracing methods last. So I'll give it a second to catch up here. So who is at higher risk for serious illness for COVID-19? We talked about this earlier. Those with underlying conditions, those with increased age, maybe they have cancer, any kind of weakened immune system, whatever it may be. All right, now make sure we catch it up here. Sorry about that. A little technical difficulties. So if you're at a higher risk of severe illness, these are the things that you should do, whether it's inside the workplace or outside the workplace. So limit your interaction with people as much as possible. So that's kind of a given there. Take precautions to prevent COVID-19 when you do interact. So make sure you're wearing your mask. Make sure you're following the proper sneeze and cough etiquette. Washing your hands, using the hand sanitizer with at least 60% alcohol content. If you do engage in public activities, make sure you practice every day preventative actions. But what we've talked about, we just mentioned with the 60% alcohol content, and what that is based on is if it doesn't have 60% alcohol content in that hand sanitizer, it's not going to permeate the membrane of that virus. And so that's where that really comes into play. Most of the over-the-counter hand sanitizer you get will have at least 60%. The one I've got here at my desk has got 70%, so it'll help out quite a bit. Delay or cancel a visit if you have symptoms of it. So if you're planning on traveling, you may want to reconsider that. Continue your medicines. Have at least a 30-day supply. That way, if you are a high risk, you don't have to go out if you don't have to. All right, so it looks like it's caught up here. So risk management practices. So we'll look at some best practices in the workplace. One thing that I will commend Kentucky on, and there's other states as well, is they will break it down into industry-specific risk management practices. So they'll tell you if you're in a manufacturing setting, these are the practices that will help limit their exposure within this type of setting. If you're in a healthcare setting or if you're in an office setting, so on and so forth. And so it's really helped out within Kentucky. I know a lot of states have done that as well. So it's some really great proactive measures that the state officials have taken. Now, this is something, OSHA recordability is something that has went back and forth several times, and we've seen a lot of confusion over whether it's recordable, whether it's not. Under their current record-keeping requirements, COVID-19 is a recordable illness and required to be recorded if there's a confirmed case that's defined by the CDC, it's work-related, and you can refer to OSHA's 1904 requirements to get that, and it involves one or more of the general recording criteria. And so probably the biggest problem with this is the confirmed case and work-relatedness. And so this is where we start getting to the contact tracing, is where we start asking the person, were you exposed at the workplace? Where were you at the last several days? If you were out at the store, if you were out at your kid's baseball game or basketball game, whatever it may be, were you taking proper precautions there? Were you wearing a mask? Were you using hand sanitizer, so on and so forth? And that'll help you determine if it's work-related or not. If they come back and they don't wear a face mask at work, but they wear one at home, or vice versa, if they wear one at work and then you say, hey, what'd you do this weekend? They say, well, I went out to visit my family. Well, did you wear a mask? Nope, I didn't wear a mask. Well, that raises the question of whether it's work-related or not. So that's probably one of the biggest areas that employers are having issues with, is determining whether it's work-related or not. So as far as policies and procedures, make sure you have a site-specific COVID-19 plan. I know a lot of organizations will have a pandemic preparedness plan, and they'll kind of incorporate it into that. But what you really need to do is you really need to update that to where it focuses on the COVID-19 specifics. Now, different areas and different states will call this something different. I know Kentucky calls it a healthy at work officer, but you may want to designate I'll just call it a COVID-19 site safety officer. And so I know a lot of the construction sites will refer to that as that, but somebody at your workplace and your organization needs to be in charge of all COVID-19 policy procedures. They need to be the go-to person for information, and then make sure that everybody is aware of who that person is. If you're running 24-hour shifts, it may be beneficial to have a secondary COVID-19 safety officer or healthy work officer, whatever you want to call it, to have a secondary one on your night shift or third shift, whatever it may be. That way you could have somebody there for everybody that needs it. Again, conduct an exposure assessment to determine who's at higher risk of being exposed based on the industrial setting. So what that's referring to is based on the job that you're doing, who's at a higher risk. And then also go look at who has a higher risk based on any kind of medical background. But you also want to be kind of cautious on what kind of information you're prying with, because you may get into the ADA issues and HIPAA violations. So you want to make sure you're taking the proper precautions with that. But then also another thing here is develop a testing plan. And so what that's referring to is anybody within your workplace that develops COVID-19 symptoms, you should have a testing plan in place to where that person gets tested for COVID-19 within 36 hours. And so you can certainly do a more stringent time frame for that. If you want to do 24 hours, 48 hours, whatever it may be, but 36 hours is a good general consensus on the industry standards here. Visitor policies. Some of you may have more visitors than others. Some of you may be visiting other facilities. If you have visitors, make sure you're adapting to their precautions as well. If they are coming to your facility, some facilities are locking the doors and making somebody come out to the front door and greet them, check their temperature, ask them if they got signs or symptoms, so on and so forth. If you don't do that, maybe have a waiting area, but make sure they have to wear a face covering. And if they're on the premises and you catch them not wearing a face covering later on, make sure you remove them from the property if they don't want to comply. Make sure you have disposable gloves, face coverings, sanitizer available as soon as they get there. That way they don't have to walk through the facility potentially exposing people. And then also have a place for them to dispose of their contaminated items as well. And as far as what we're going to train our employees on, you need to train them on how the COVID-19 disease, what the COVID-19 disease is, how SARS-CoV-2 spreads, and so the risk of exposure on the job, whatever their type of job is, you can break it down as detailed as you want to, or you can say, hey, we're in an office setting, we got a fairly low exposure level. But if you're in a medical setting, you may break it down into different departments, different areas, based on whatever type of job they're doing. Teach them how to isolate individuals. You don't have to go into the full details, but at least give them a general idea. Tell them how to report possible cases to the internal personnel. Again, who that site safety officer or healthy work officer is, their contact information, and then any other proper protocols. But one of the biggest things we need to do here is proper use and limitations of the PPE. And so there's a video coming up here in a little bit of a study that some of you all may have seen from a recent study from the Duke University Physics Department. They tested out 14 different masks, or I should say face coverings, and they looked at the effectiveness of each one. And so explain to them which ones are designed to work better, which ones have X amount of limitations, how to properly use it, and to make that readily available for them. So next we'll look at engineering controls. So things that we can do to eliminate the virus potentially at the source of the exposure. So either using non-porous physical barriers where physical distancing is not practical. So if I can't separate somebody by 6 feet, maybe I'll put up a plexiglass barrier to separate the workers to where I'm not potentially doing that. Considering alternatives to high-touch time clock systems. So every day we're coming in, we're punching in the time clock. Either I've seen some companies that will put on, they'll put a bottle of hand sanitizer right there at the time clock. But the best practice is to sanitize it after each use. So maybe have a thing of hand sanitizer. They put the hand sanitizer on first. They'll punch in the time clock, and then they'll have a aerosol or some kind of sanitizer that they can use right afterwards to go ahead and sanitize it afterwards as well. Touchless trash receptacles, soap, paper towel dispensers. That's kind of a given there. I know some of you may not even have to deal with that. And then improve your ventilation using fans or windows. So if we're spreading that virus, if we're keeping it from being stagnant in one spot, hopefully, this, as you can see there, the HEPA filtered air mover, that can filter that out. That will be even better for us. Administrative controls. So what we can do from a work practice control or a policy standpoint is requiring people to stay home when they're sick. It's kind of given. But also conducting daily temperature and health checks. Now, one thing you want to keep in mind with this is you might be getting, again, into the HIPAA violations, the HIPAA protection, the ADA protection there. So stagger your shifts, install COVID-19 related signage in conspicuous areas, reduce office staff to less than 50% capacity if possible. Let's see here. Hit the last one of the administrative controls. Ensure workers do not use cleaning products that could re-aerosolize infectious particles. So what they're meaning by that is if you got a dusty environment and you're dry sweeping or using air hoses or nozzles to spray stuff off, make sure you're not doing that because that could potentially spread it. Minimize interaction between drivers and loading docks. And then PPE. It's probably one of the biggest ones here and the easiest ones that we could do. Offering face coverings and disposable gloves to everybody free of charge. Make sure we're trained on the proper use of it. And then we require disposable gloves and gowns for anybody that's doing cleaning related tasks. So anybody handling trash, make sure we're wearing gloves, disposable gloves and gowns, and then have a place to dispose of that properly. As far as cleaning and disinfecting, use a EPA registered disinfectant that's on list N. Make sure we're not forgetting our SDS, so we're familiar with what that is. Follow the disinfectant's contact time. So what that contact time is, once you spray that disinfectant on there or put that disinfectant on there, how long it takes before you can wipe it up. So that list N will, if it's on that list, EPA's list N, it will have a contact time in that chart to tell you how long you need to leave it on that surface. Wipe things down at the end of the work shift. Have field service employees wipe down their vehicles, spray their luggage down with aerosol at the end of each day. And then if a workplace is confirmed, a COVID-19 case is confirmed in the workplace, close off that area that the ill person was at and wait at least 24 hours before cleaning to reduce that risk of exposure. So it gives it a little bit of time to die off. So some of the high-touch surface safety things that we want to disinfect pretty frequently: doorknobs, faucets, and bathroom fixtures, countertops, tables, trash cans. We talked about earlier with our car door handles. And so we'll get, moving wrong way here. So this next section here, we're getting to PPE. We'll touch on it real briefly. I know we're kind of running short on time here. We'll touch on this one real briefly, but I want to look at this study from Duke really quickly that they did on here that will show you how they did the study, and we'll look at the results of their study. And so it was done by the Duke Physics Department.
Day 4, no mask, trial 1. Start.
Stay healthy, people. Stay healthy, people. Stay healthy, people.
So the experiment is a visualization of droplet emission, and we compared no mask versus masked speakers. We had speakers say, stay healthy, people, without the mask, and we used that as a baseline. And we then put different masks on and visualize the effects of that mask that should reduce droplet emission when you speak. So this is what's under the hood. Not much. So the setup is very simple. It's one laser, one cylindrical lens, which turns the laser beam from a beam into a sheet of light. One mirror getting the light into the box. A box which you can construct out of cardboard, and a camera, which in this case we can use a cell phone camera. It's very straightforward. It doesn't take much resources. Any research lab has these things lying around. The laser, we use a very expensive laser because that's what we had, but you can buy a laser that does the same trick for about $100 online. So we have the speaker hole right here. We have the light sheet going in from the left side, going out the right side, and the camera on the far end looking at the light sheet. And when you speak and you emit droplets, and as soon as they go through the light sheet, they scatter light. So you see a little flash of light that gets recorded by the video camera. So when we speak, we see this evolution of flashes in the video frames, which we then go in and analyze. How many flashes do we see? Basically, how many particles do we see? This is the no mask case. This was a cotton case. This one is a surgical mask. So you can see it actually does really well. This one here is fleece, neck fleece. And what's noticeable here is that the number of particles is actually bigger than the no mask case. We attribute this to the fleece, the textile, breaking up those big particles into many little particles. They tend to hang around longer in the air. They can get carried away easier in the air. So this might actually be counterproductive to wear such a mask. So it's not the case that any mask is better than nothing. There are some masks that actually hurt rather than do good. Because this was a demonstration experiment, we only did a few number of speakers, but it gives you a good idea of how the mask actually performs in general. So we certainly encourage everyone to wear a mask, but you want to make sure that when you wear a mask and you go through the trouble of making a mask, you make one or wear one that actually helps, not just you, but helps everyone. The appeal of this measurement technique is because it's conceptually very simple. and it's easy to get started, and it's easy to operate. Ultimately, for real research questions, you want to construct it reliably, good construction. But for demonstration experiments, a cardboard box will suffice. Yeah, there's lots of duct tape on this gizmo.
Shows which masks are most effective, and these are just the materials they had. But the fitted N95 without a valve, of course, was the #1 most effective. The 3-layer surgical mask, as you can see in the very first picture, top left-hand corner, is the second most effective. And that's the one I personally use in most of my occasions. You can buy them pretty inexpensively. Now, if you look down at the bottom, number 14, the least effective, according to this study, was the gator style neck fleece, and you can see it from picture 11, kind of center on the second to bottom row there. Now, even though that said that it's the least effective in the study, they did come back and say that that's just based on the particular one they have. If they said that if you fold it over, make it 2 layers, 3 layers, whatever it may be, that's going to increase that effectiveness as well. And so, looking at the results, we just talked about with their follow-up statements, is that the net gaiters are not necessarily inadequate, but it just depends on what it may be, what material you have, what if you're folding it over to where it's 2-fold, 3-fold, whatever that may be. Now, these next slides are going to go over how to properly use the N95 respirator. I'm going to skip over this. Everybody will get a copy of the slides during after the presentation, but this just goes through step by step. So these are good things to include with your employee training to show them how to properly do it, because there are things that you don't want to do. There are things that may make it more or less effective. So again, everybody will get a copy of this. I want to make sure we hit on this last section here, is the contact tracing. So taking action when you have a confirmed case within the workplace. So a case of COVID-19 requires action. So diagnosing a case of this is important because we have to act. We have to support both the person who is infected, but also identify those people that may have been infected as well. Maybe they come into contact with them in a various setting, limit their exposures. So how long should a case be isolated from others? The short answer is ideally as long as they're infectious, but the long answer maybe gets into a little bit more in detail than that. So it's until they fully recover. So that's based on those CDC guidelines. So monitoring their symptoms, no longer infectious, must isolate for at least 10 days after the onset. So defining the infectious period here. So we're going to say that a case identified and we contact this person A, on August 9th. So you can see the little icon here. We contact them, they say, hey, I became ill, I started getting symptoms on the 8th, the day before. So now what we're going to look for is that 2-day previous period. So the 2 days prior to when they started showing symptoms is when they were infectious. So if you go back to the 6th, this will show you their infectious period is from August 6th, which is 2 days prior to showing symptoms, and to August 18th, which is 10 days after they started showing symptoms. So that defines our infectious period here. So we do a follow-up after that. We need to do ongoing follow-ups to know if they can stop isolating from others. Need to know when the symptoms resolve without medication. So we follow up with them on the 18th when their scheduled time frame ends. We see how things are going. So let's assume they fully recover by the 18th. So now we know their infectious period. You can help them identify their contacts. So if you call them on the 19th, like we just mentioned, we ask them about their contacts they had between August 6th and August 9th. And that's when we can start our contact tracing methods. So how long should a contact be isolated from others? Again, short answer is ideally as long as they can be infectious. Long answer, 14 days following the last contact. If they develop symptoms, we should go ahead and presume that they are a case. So again, we're going to go through a little time frame here to break it down. So we're going to assume we call the contact on the 12th. Based on the call, they had their last contact with the case was on the 9th. So again, the contact is the person that was exposed to the person with COVID-19. So they said, I last saw this person on the 9th. And so they receive instructions to quarantine for 14 days since that last exposure. So if the last time they saw them was on the 9th, 14 days post that will be the 23rd. So they'll be at least quarantined up through the 23rd, and then of course do a follow-up after that. And if you want additional information on this, there's a lot of agencies out there that have great information. I know the American Industrial Hygiene Association, AIHA, the Institute of Hazardous Materials Management, CPWR, OSHA, all these agencies all have specific parts of their website that will have information about COVID-19. And with that, that brings us to our Q&A at the very end.
That was great, Drew. So we are coming to the top of the hour here. So I just wanted to let everybody know that, yes, you will all receive a copy of the webinar slides as well as the recording in a few days once we get it all put together. We do have a ton of questions that came in during the webinar. So to anybody that we don't get to because we are running short on time, I just wanted to let you know I will be forwarding all of your questions over to Drew, and he can reach out to you individually as he sees fit. So great presentation, Drew. There was a lot of old information, new information. So I'm really excited to dive into these questions here. Our first question. This question actually came up quite a bit. A lot of people are refusing to wear masks. They say it's their right. They don't want to follow procedures, whether it's hand washing or using a face covering. So what do you do when you don't see people following these procedures?
Well, as far as following procedures, there's really only a couple of things that they can claim their medical exemption on. And really the main one there is wearing the mask. And so, you get people that are pregnant or have respiratory issues. If they're wearing a mask, it may cause a greater hazard by wearing that because it may cause a greater stress. Now, as far as if they want to say that they're exempt from that, honestly, a lot of states will even put this in their policies. There's really not much we can ask about that. Now you can kind of dig in behind the scenes, you could say, dig in to see, have they ever complained about having these certain issues? If they're saying they have a lung issue, have they ever had any other issues, with that related in the workplace? But you kind of got to tread on that pretty lightly. Now, if they're saying they don't want to wash their hands, that's a whole different story. They're really, we should encourage them to do the right thing and talk with them and just I put the ball in their court. What if somebody was not doing this and they're the one that affected you or your family? How would that make you feel? So kind of put the ball in their court, put it into their perspective, and just really tell them it's all about doing the right thing, making sure that we're pressuring others to and take care of each other, and that way we can all stay healthy at work.
Right.
That's a good question.
I mean, I know it's going to be dependent from company to company, country to country, state to state. I know here in Canada, we have several different rules, province to province, city to city. So reflecting it back to make it more of a personable approach and to say, what would you do? That's a really great approach. We have a question from Phil. What digital tools, apps are people using for contact tracing or return to work procedures?
So there is actually there are several apps out there. There's a COVID-19, Apple has a COVID-19 screening tool that you can do there. And then there are several apps. A Care-19 alert, I believe, is one you can log it, and basically it will use your phone settings to determine if you were close to somebody that had it. I know I've heard a lot of people get into the privacy issues on that, but what it'll do is it'll basically track your location, and if there was a confirmed case that was reported to the local health departments or the local health officials in that area, it'll notify you that you were in that space. And I know there's a lot of tracking software as far as computer-based programs as well. But like I said, the Care-19 is probably one that I've started to see a lot of people actually download. But you can probably Google this, and I mean there's probably close to 100 that I've seen, different apps, mobile apps, phone computer softwares that will track that out there. So, but as far as which one's better than the other, I couldn't give you a preference on one, but I do know there are a lot out there. But my recommendation is to keep an eye on the CDC. I know they're working on putting some information in some of their websites and mobile apps as well. So just keep an eye out on that. Yeah,
absolutely. And again, it's going to depend on your location, who has apps, who's using apps, what's available. So I guess our best recommendation is to check your local community and find out what's being used and what's available to you. I'm going to ask one more question here, and then, like I said, I will forward everybody's questions over to Drew, and he will get to them. This is a question from Lima. How has the pandemic influenced, or how could this pandemic influence and establish standards in virus protocols going forward?
Honestly, I think it's going to be a huge eye opener for moving forward. I mean, personally, everywhere I've worked, we've always had a pandemic preparedness policy or procedures in place. But to say we actually trained on it at every organization I've been to would be a lie. I think this will be a definite point to where we're all going to focus a little bit more on what this is. Just being brutally honest, unfortunately, I think that the longer this COVID-19 goes on, I think people will start to get more relaxed, which is where we're going to lose where we really, I guess we should say we need to start catching that we're being complacent. But I think that this is certainly a great opportunity for us to look at what our procedures and policies in place as far as infections within the workplace, figure out what we're doing. And my recommendation is, we've got people from different states and different countries and different parts of the world here, is look at everybody else, what everybody else is doing. I mean, like, the resources I mentioned earlier, I know the AIHA has several documents on general guidance and construction industry, and so does OSHA and everybody else. But see what everybody else is doing. I know Kentucky's got a pretty intense and very detailed plan as far as industry specific, and they will tell you what needs to be put in place, because your hazards are going to be different. If you're at a fixed facility versus at a construction site to where you're moving around, you may have to take different procedures. And so I'd recommend, networking on LinkedIn or wherever you choose to network with others, see what they're doing, check out with these organizations, professional organizations, see what they're recommending, and kind of get a compilation of things. But it's certainly definitely going to, I think, improve our awareness of a pandemic in the future. That's a great question.
Absolutely. So we're going to wrap up the Q&A, and Drew, I just wanted to turn it back to you if you had any final words for the audience.
I just want to thank everybody again for your time. As you can see, my contact information is up here. If you want to follow myself on LinkedIn, or my company will continually post, updates on this and helpful information. Hopefully it'll benefit you or your organization. But as you see my email there, if you want to reach out with any questions, whether, if you think of it 2 days later, whatever it may be, feel free to reach out, and I'll be glad to help out any way I can.
Perfect. Well, on behalf of Safeopedia, we'd like to thank Drew and our sponsor, Intellex. Thank you for attending today's webinar. So thank you again. Take care and stay safe.
Registration is now open for Safety Connect, 2020's premier virtual safety conference and expo. Head on over to industryconnectsafety.com for all the details. Friendly reminder, Safety Connect is free to attend. You heard that right, absolutely no cost to you. We've got hundreds of giveaways, 3 grand prizes, world-renowned speakers, and tons of exhibitor booths to visit. Head on over to industryconnectsafety.com. See you there!